Thank you, Danielle, and good afternoon. In August of 2009, 4 years after Hurricane Katrina struck the city of New Orleans, the New York Times published a remarkable investigative story titled "The Deadly Choices at Memorial." Written by Sheri Fink, a reporter who happens also to be a doctor, the piece reconstructed what transpired during the hurricane at Memorial Hospital, where 45 corpses were discovered after the storm, more than at any other hospital in New Orleans of comparable size. As Fink showed in her article, which was based on more than 100 interviews and went on to win the Pulitzer Prize, these deaths were not simply the product of a natural disaster. They were the product of fateful choices made by medical professionals, in particular, the choice to hasten the death of at least 17 patients by injecting them with morphine and sedatives because evacuating them to safety was deemed unfeasible, a decision made without input from the patients or their family members. 4 years after that remarkable story appeared, Sheri Fink published 5 Days at Memorial, Life and Death in a Storm-Ravaged Hospital, which has been selected as the winner of this year's Ridenhour Book Prize. Now, I don't think the judges who determined the prize knew this, but if it had been up to Sheri alone, I don't think her book would have been eligible for the prize this year because she would still be working on it. As her editor at Crown, Vanessa Mobley, who I know personally because she was the editor of my own first book, informed me recently, I'm quoting, quote, "Sheri's devotion to reporting and arriving at her own understanding of the events at Memorial was so complete that she reported and wrote her book until what is, in book terms, the 11th hour. We were going to press, and the book was changing near daily as a result of the conversations she continued to have with her subjects." End of quote. That's a polite way of saying we had to twist Sheri's arm a little because she's such a perfectionist. But it's also why 5 Days at Memorial is the extraordinary book it is. On one level, the book is a superb piece of narrative journalism and investigative reporting, putting readers in the shoes of doctors, nurses, and patients trapped in a disaster zone. On another level, it is a searching exploration of medical ethics and accountability that poses much larger questions. Which patients should be treated first in a crisis? Which patients shouldn't be treated? Should medical professionals have the right to hasten the death of some patients without consulting their family members or anyone else, and then be immune from lawsuits for the decisions they've made? This is the position some doctors at Memorial adopted. It is not the position of the Institute of Medicine, a highly respected organization that issued a report after Fink's initial article in the Times concluding, quote, "Neither law nor ethics support the intentional hastening of death, even in a crisis." For helping to spark a public debate about this question, and for exploring this freighted subject with a tenacity and moral seriousness that Ron Ridenhour would have admired, I'm honored to present Sheri Fink with this year's Ridenhour Book Prize.